Yes, I think this goes back many years. I think the basic driver for me was seeing patients suffering. I did have a few family members that I was a child who went into the hospitals because of various reasons. And what happens in hospitals and what the doctors do really impressed me. At one point in time, I think during the A levels time, I was in two minds because flying used to interest me a lot, seeing aeroplanes fly up, and that used to be my initial passion to follow that as my career. But then I think wisdom prevailed, and I decided that for lifelong, I would be much more happier internally if I did something which benefits others rather than getting pleasure for myself. And that was the driver. Basically, helping other people was the main reason, and the satisfaction you get from it is absolutely undescribable. And that is still the case. I enjoy each and every day of my career as I did the first day when I became a doctor. Through my medical education, I had made the decision that I am going to be a surgeon. So that's more hands-on, and it sort of satisfied me more than the medical side of things. Although I think both medicine and surgery are equally important. So having decided that I wanted to do surgery, I pursued a surgical career in the initial years, and then I got lucky enough to get into a rotation for training as a registrar, which included urology as one of the specialties. And going through various surgical specialties, I found urology to be most suited to my temperament in terms of it has the option of doing major surgery, and it also has the option of not doing the major surgery if you opted to do so or wanted to do so. I think the wide spectrum of surgical procedures which are available. And secondly, it is a specialty which has patients all over the world. You go to any community, any country, anywhere, urological services are in demand. And thirdly, the quality of life as a surgeon is very important to me. My family life is very important to me, and this specialty seems to offer that emergencies are not as desperate as in some of the other surgical specialties. And lastly, I think the results that you get after doing good quality work are very good. Most of the patients do get better, large majority get cured, and you can make a big difference to people's lives. So I think that was the background that took me to urology. And then the interest goes on, it has never faded away, as urology is a very dynamic specialty. Every year you see new techniques coming in, new equipments coming in, and it's in a continuous phase of transformation, getting better and better and better. So that keeps me going. I think it again goes back to the reason I went into this job, that is the ability or capability of helping others and making a difference to other people's lives in a very positive way. I think I do have a very firm belief that doctor-patient relationship is very special. It's not a mechanical relationship, and there's a lot of emotional involvement on both sides, which is essential to achieve the results that you want to achieve out of it. And I think keeping my patients happy and giving them the confidence that I will respond to their needs and will offer my best advice according to my ability is I think the most important thing. And from the patient's perspective, I think once they develop confidence in me, looking after them through their different problems, and then the ability to take them through this journey in a supported manner, I think is that what they feel valued. Yes, I think challenges are always there. Continuously improving the service is a major challenge in urology. The reason for that is that the resources are always limited, and the advances are always happening. And as a clinician, my aspiration or desire is to offer the best possible treatment to every patient that I see. But because of sometimes financial constraints, sometimes logistic constraints, it is not possible to do that. And that is that I find quite a challenge. In addition to this, I think when you look at the global situation, urology is a specialty which is quite well developed in the developed part of the world, but the huge amount of work still needs to be done in the underdeveloped world. And I do spend significant amount of my time doing work in other areas which is less developed, and it's always very challenging as well as rewarding to be able to make a difference in other parts of the world. So I think that's another challenge that I enjoy addressing. I'm not sure that I will have a positive answer to that. I don't think I think I always give patients hope, and especially when dealing with patients who have more serious conditions, it's very important to maintain a positive attitude. And I would be realistic, but at the same time, I always use the word that you're going to get better, and encourage them and help them to be positive.